This case is by a new grad that we hired a couple months ago. This is only about his 8th case with the Venapax. He had never had any experience with EVH prior to this. In the beginning here, he's getting around either side of the vein with the conical tip. This allows you to work your way into that posterior plane while freeing the vein up in your proximal tunnel. Just inside the port, you can see there's an early branch going about the 11 o'clock position. He's going to gently dissect that out, and he's going to advance the cutting blades of the Venapax. You'll see that the blue blade will come out above the branch. The green blade will be below the branch. He's going to position the tip of his conical dissector below the branch. He's then going to push up and lateral, extending the length of the branch before activating the bipolar cautery using a tapping motion with the blades. And then he's going to give a slight counterclockwise rotation and advance forward while following the vein with the conical tip. There you see a nice clean cut, no bleeding. The hemostasis is better than any device I've used before. Here he's going to sneak posterior so he can continue his posterior pass. As soon as you encounter branch, you gently dissect it out. You see how he doesn't advance too far. That way he's not going to stretch that branch too much. You then want to lift your tip up so that when your blades come out in the 5 o'clock position, they're not going to dig into the posterior fat. Here he's going to rotate the blades over to that 5 o'clock position, and he's going to try to sneak that green blade into the window to the right side of the branch. Just remember, this is like his 6th or 7th case. He had done a couple partial cases where he was allowed to take, branches that I had set up for him. But this whole case, I did not touch the scope. Here he gets that green blade in. Now he's going to capture that branch, pull down towards 5 o'clock. Now he's going to activate, do that tapping Pac-Man motion. Now he wants to rotate clockwise and push forward. There you saw the branch cut. Now he's continuing his posterior dissection. Right there, he's coming up on a 6 o'clock small branch. Here he's going to spot cauterize that small bleeder on the side wall. Prevention is absolutely the key to a dry tunnel and excellent visualization. Everyone who's taken vein before knows that once you get a bloody tunnel, that red just absorbs a good majority of your light. The camera's exposure turns down to compensate, and everything is quite dark. So taking that extra couple of seconds that he did to cauterize that, which he'll do multiple times during this video, really saves you tons of time. Here he's going to line up with that 6 o'clock branch. See how he lifts the blade up off the back walls so he doesn't catch all that fat. Once again, he's going to pull down a little bit. Activate the bipolar, tapping, and forward push will cut the branch. Now he's going to continue the posterior dissection. He's back in plane here again. See how the tip's in that nice wispy cobweb connective tissue. That's the perfect plane, not disrupting the adventitia. So what I have them do after this is, once you've done maybe 4 inches posterior, I'm going to have them come back anterior and do his anterior pass in that 4-inch segment. Here he's got a small anterior branch. So he's going to do just a slight amount of dissection on either side. Now he's going to want to bring his blades out in the 12 o'clock position. He's just clearing a little runway so that when he gets his blades out, he can push forward and cut that branch. So you want to line your tip up, in this case to the left side of the branch. so that your blue blade, which has a sharp cutting edge on it, will then be rotated counterclockwise towards the tip of the cone as you're advancing and activating the bipolar energy. Then you just want to continue with your anterior dissection. Here he's doing some spot cautery because there's a little bit of oozing of some crossing vessels in the subcu fat. You just open those two blades up, maybe 2 millimeters between them, and lay it down on anything you want to spot cauterize. Now he's going to come back and clean off the sides. See how the connective tissue is just going out in the 3 and 9 o'clock position. You can just come out at 3 o'clock here, capture the tissue between his blades, activate the energy, and push forward. Here he's going to do the next section. And here he's just going to follow that vein with his tip. The vein's 180 degrees away from where those active blades are, and is thereby protected by the cone. Anytime you want to switch sides, you want to come back, switch sides with your cone so that the vein doesn't get wrapped around the shaft of the device. Now he's going to retract the vein to the right with his cone, exposing those lateral branches. He's going to bring the blades out closer to 9 o'clock, capture that tissue, activate the cautery, and slowly push forward to cut. See that great fine Pac-Manning tap of the blades. The reason for that is because it's bipolar energy. Anytime you completely touch the positive and negative blade, you're going to get grounding. So you're not going to get energy transfer between those two blades. And that's why we do that fine tapping motion, because it actually creates a small gap, which allows the energy to transfer through the tissue. There he was just doing a little spot cautery in that oozy section. Here he's going to capture that lateral connective tissue and fat that's just stuck on the vein. Rather than just tearing all that off with the cone, it's easier just to come in and burn that. You have less chance of tearing small branches that way. See how he had his tip kind of stuck on that tissue there, but he corrected by backing up and getting the tip to go over that. Now the vein is safely to the right of the cone, and he can burn in advance. He's using the tip correctly to lift the vein up and make sure he's not missing anything on the side. There's a little crossing arteriole. And here, you want to be careful and you want to keep an eye on that. Make sure as you're going through there, you haven't torn that, which can cause a lot of bleeding in your tunnel rather quickly. So instead of just dissecting through there, because that's all you can do with any other device, he can bring his blades out and spot cauterize that vessel. So here he's going to open a gap, push down onto the vessel, and activate the bipolar. You see that mist? All right, so there he's cauterizing the branch. Here he's going to dissect that branch out very gently. As you can see, it's a very small and thin vessel which could tear quite easily. All he needs is to get a small window there. Rotate his blades up to, say, 10 o'clock. He's going to sneak the blue blade in just above that little arteriole. Activate his cautery. Pushes away from the vein to protect it. Tap, 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 and push. So now he finished that, say, 4 inches anterior, posterior, and both sides. He's going to go back to posterior and do the same thing over again. The reason you prefer to do this is because, if he had had some bleeding in that first 4 inches, he would now be working into new clean tissue again. And he's got a great image the whole time, but had he had that bleeding and couldn't see as well in the beginning, if you had done your whole posterior tunnel, that bleeding would track up the whole posterior tunnel. So by doing it in segments, you know that you have cleared off circumferentially that whole 4 inches, and now you're going to move on and clear off another whole 4 inches or so. Dissects out that small branch at 5 o'clock. He had a little bleeding on the side. Brings out his blades and does some spot cautery again. See how he leans into the tissue and kind of grabs it and burns. He checks it, makes sure there's no bleeding, and continues. He's going to capture that tiny branch. You just can't do this with any other device. That branch, you would have to simply ignore it and continue dissecting. If that had bled on the side, you'd have to just dissect faster. Not with the Venapax. You can stop. It takes you 2 seconds to put your blades out. Either spot cauterize or ligate the branch. See how he doesn't pass point too much? If he kept going, the cone gets larger and it could potentially tear those little branches. So we teach him to just use the tip of the cone, just enough to get the tip of the blades in. Activate the cautery, little tapping and forward motion. Here the cone is opposite the green blade, so he's going to turn towards the cone in a clockwise fashion. You always want to turn towards the cone. It acts as a fulcrum point. and that gives you some leverage to cut the branch. Here he's getting up in the upper thigh, and that branch you just caught sight of is the medial branch. Here you saw a little bleeding. Once again, I teach them, as soon as you see any of that, spot cauterize it. Here he's just getting that last couple of inches up to the groin crease. Here I have him push in with the scope literally till it's hubbed out and maximal length. And then you use your, let's see, on the right leg, you'd use your left hand up on the thigh, and you take a big grab of thigh and pull it down towards the scope, towards the knee. This usually allows you to get another 2 to 3 centimeters. It also tightens up the vein when it becomes kind of loose, and that makes it easier to dissect. Here he's come back to where he's circumferentially dissected the vein. I usually have them go all the way back to the beginning, pick the vein up just to make sure nothing is still attached. Just float the vein up on the top portion of the cone. See how that elevates the side branches. You can come across with your blades and just cauterize in advance. There he goes again. It's that next piece of tissue there. I'm just going to go back to dissecting anteriorly. I teach them that it's much better to cut than to just tear, even with a atraumatic cone. Once you get that tissue separated, just use your blades and cut it. Here's an 11 o'clock branch. Little dissection on either side. Blades come out. You want to rotate them over towards 11 o'clock. You want to capture just the branch, then lift before you fully close. So he's pushing towards 11 o'clock right now. Now he's activating the blades and tapping. And then he pushed forwards, and you see how easily that branch cut. You got to remember, this is not someone like me who's done thousands of EVH cases. This is a new grad who literally has had his hands on the scope probably less than 10 times. Has only been allowed, due to time constraints, to, from start to finish, have his hands on the scope maybe 6 times at most. And he's doing a phenomenal job. The system is much easier to learn. There's far less moving parts, and the cautery works better. You don't have to just blast through the entire dissection, potentially tearing many of these little branches, because that's all you can do. You can't go back and forth rapidly. You have to really clean your scope if you want to go from ligating branches back to dissecting, or else you'll fog up your tip. Here, all you got to do is slide your blades in or out. If you didn't dissect enough, you put your blades away and you dissect some more. There's another branch. He's going to get the blades around. He's going to close them. He's going to activate the cautery, rotate counterclockwise toward the tip, just a little bit, and then advance forward. And as he advances forward, he wants to follow the vein. A little more dissection. He cuts those branches. You cannot tell me with any other system that you would have had to do anything other than push through those small branches and hope they tear along. You really had no other options until now. There's a little bleeding at 12 o'clock. Spot cauterize. Come back down. Take the branch at about 1 o'clock. See how he grabs it close to the vein and slides out. It pushes all that fat into the lateral wall. Now he's going to tap, activate, and push forward. There you see the branch fall away. Here the vein was really stuck anteriorly, but he was patient and he gently kind of worked it off the ceiling. Here he takes that fine little branch. Back to dissection. The system is just so natural. You know, for so many years, we wanted to be able to cut branches as we dissected. And we finally have the tool to do it. We don't have any kind of retraction device to torque and tear branches. But you see, you don't need it. I spent years perfecting how not to use those devices with other systems. And I would say that most new harvesters use those devices as a crutch. They can't dissect, they can't cut these small branches. So what do? They wrap around it and they just pull through it. I guarantee their tunnels aren't this dry. And I guarantee they don't end up with a conduit that has no 7/0s in it. Again, he's cutting that little piece of connective tissue there. Tap and burn, push forward. He's going to get back into his anterior plane. And you notice how he uses the porpoising motion to kind of peel that off. So you go in anterior and kind of pull back and push down when you're stuck like that. It's a little more segmental anterior dissection. He's got a little oozing on the left side there. Puts his blades out. Pulls out wide to stay away from the vein. And cauterizes it. A little more dissection. Oozing on the side wall. Does a great job taking the time, put those blades out, and stop the bleeding. He's just getting that last little bit. At this point, he's past the medial branch. He's all the way up into the groin crease. You really got to pull lateral, and he's going to use the counterclockwise rotation to get some torque on that tissue to cut it. And he's going to push forward and pull back on the thigh and get that last couple millimeters there. Now he's going to come all the way back. Run the vein with the cone. And get anything else that he might have missed along the way. Just bring those blades out at 3 o'clock. Tap, 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 and push forward. You just got to keep that vein to the left side of your cone, and that protects it. You got about 4 millimeters of distance from the center of that cone out to those blades. A couple little adhesions left. There's the cautery. Slight advance. The tissue cuts away. You see there's no smoke. You get a small amount of water vapor when the tissue cuts. And it just wipes off the cone as you dissect. Here's that big medial branch. Pulling lateral, slight counterclockwise rotation, the Pac-Man tapping motion while he's activating, and then he's going to start to push forward, and boom, cuts that branch. No bleeding, not 3 millimeters of char. And the stump is dry on both sides. One last little branch. Now he's up at his saphenophemoral junction. And you want to pull back. Say the vein was on top of his scope. You pull back, let it fall down below the scope before he does his stabbing grab. Here you can see he's palpating skin. Use an 11 blade to make a small nick up in the groin crease, right above the tip. I teach people you don't want to see your knife blade. Some people want to visualize that 11 blade coming in there. I think that's far more dangerous than anything else. You want to come through with blunt dissection. We use a tonsil. Always aim the curve of the tonsil towards your knee, and then you always cut on the curved side. This tonsil is a little medial initially. He's going to come back in a little bit more lateral. Pop through that anterior fascia. You want to point that tip towards your knee. A little bit deep there. There we go. Nicely cleared the tip. Now he's going to open his clamp, roll the handle back towards the knee, and grab the vein. Here he's going to pull it back. He's going to cut the loop on the curved side of the tonsil. He's going to bring his scope back. He's going to use the two blades to grab the tip of the vein. Always make sure to push your foot pedal away so you don't accidentally activate the blades. He's going to gently pull it back. And you can watch it the whole time to make sure you don't get caught on anything or miss a branch. Here I had to take a quick clip just to show you. This is after the vein was cut out. I went back and milked the leg just to show you how dry this tunnel is. Not a drop. Here's a quick still shot to show where the incision is, usually just above the crease in the knee. You see it's only about 1.5 centimeters. And thank you for watching. We hope you enjoyed the video. I want to thank Brendan McCarran one of my PAs, for sharing this very early experience with the Venapax device. If you enjoy this content, please click like and subscribe to my channel. If you'd like further training in the Venapax system, please reach out to myself at EVH Consultants at gmail.com, or reach out directly to Safina Medical and request a trial. Give it 10 cases and you will never turn back. Thank you.